Did you know? Well, let's talk about something important: vaginal health. Specifically, a common condition called bacterial vaginosis, or BV for short. Many women experience BV at some point in their lives. Don't worry, we're going to break it down and make it easy to understand. Bacterial vaginosis is not a sexually transmitted infection in the traditional sense. However, it can be linked to sexual activity. It's more about an imbalance in the vagina's natural environment. Think of it like a delicate ecosystem that needs to be in harmony. Sometimes the bad bacteria in the vagina outnumber the good bacteria. This imbalance is what leads to bacterial vaginosis and its uncomfortable symptoms, but more on those later. Understanding BV is the first step to prevention and treatment. So, let's dive in and learn more about this common condition. BV happens when the bacterial balance in the vagina is disrupted. But what exactly causes this imbalance? Several factors can contribute to BV. Douching is a major no-no. It can wash away good bacteria. This makes the environment more susceptible to BV. New or multiple sexual partners can increase the risk. It's about introducing different bacteria. Even certain soaps can upset the balance. Harsh soaps or scented products can irritate and disrupt the natural pH balance. Bacterial vaginosis is much more common in women than in men. This is because the vagina is a complex environment. It's home to a delicate balance of bacteria that can be easily disrupted. Women can be carriers of BV without even knowing it. That's right, many women with BV don't experience any symptoms. This is why regular checkups with your gynecologist are so important. While BV is not considered a classic STI, sexual activity can play a role in its transmission. Having a new sexual partner or multiple partners can increase a woman's risk of developing BV. It's important to remember that BV is not a sign of poor hygiene. Many factors can contribute to its development, and it's a very common condition. Section 4, Bacterial Vaginosis in men, an unexpected twist. Here's an interesting fact. Men can carry the bacteria associated with BV, even though they don't develop the condition themselves. This means that men can unknowingly transmit the bacteria to their female partners. While BV doesn't typically cause symptoms in men, there are some exceptions. In rare cases, men may experience inflammation of the urethra, which can cause discomfort during urination. If a man's partner has recurrent BV, it's a good idea for him to get tested and treated as well. This can help to break the cycle of transmission and protect both partners. Remember, communication is key in any relationship, especially when it comes to sexual health. Talk to your partner if you have any concerns about BV or other infections. Section 5, Recognizing the signs. Symptoms in women and men. Now that we understand how BV is transmitted, let's talk about the symptoms. As we mentioned earlier, many women with BV don't experience any noticeable symptoms. However, when symptoms do occur, the most common one is an unusual vaginal discharge. This discharge is often described as thin, grayish white and having a fishy odor, especially after intercourse. Other symptoms of BV in women can include vaginal itching, burning during urination, and redness or irritation around the vaginal opening. If you experience any of these symptoms, it's important to see your doctor for diagnosis and treatment. As for men, Symptoms are rare, but as mentioned before, some men may experience urethritis, characterized by pain or burning during urination and possibly a discharge from the penis. Section 6. Taking charge. Prevention and treatment options. BV is treatable and preventable. Let's start with prevention. Avoid douching as it disrupts the natural balance of bacteria in the vagina. Using condoms can reduce the risk of BV, especially with multiple partners. Opt for gentle, unscented soaps and avoid irritating feminine hygiene products. If you develop BV, your doctor will prescribe antibiotics. These come as oral pills or vaginal creams. Follow your doctor's instructions and complete the antibiotics course. BV is common, there's no shame in seeking treatment. Take care of your vaginal health to stay ahead of BV.